This is Katie Horvath, CEO of Navigo, and I am privileged to be introducing to you our next speaker, Ms. Kathy LaRaia. Kathy is the Executive Director of Oncology Services at Munson Healthcare.
Hi, we're here today with Kathy LaRaia, who is coming to us from Traverse City from the Munson Healthcare Oncology Group at the Cowell Family Cancer Center.
We will be celebrating a milestone of our 5th year of opening this spring. Mm-hmm. And even through the pandemic, patients will say that are new, there's a calming aura here, that it's fearful when you walk in. And once you're in here, between the gloriousness of our staff and the aura of the facility, it helps people get through what they need to get through. And after 5 years, I'm pleased to say that's still the aura. That's what I try hard to protect.
Right. Well, the people could not be kinder there. They are the nicest people.
We've had a tough year. We've been through some tough times. And I think the resiliency of the staff through all of this has been exceptional, not to mention to be diagnosed with cancer during a pandemic is unfortunate. And so we're doing everything in our power to make sure we don't miss a beat. So between the gallery, the meditation gallery, and the support services we provide with social work and nutrition and genetic counseling, we've been able to stay the course.
Mm-hmm. That's amazing. You guys have always been heroes for me, and I just cannot say enough great things about you or Munson or the Cancer Center. It's really a very, very special place. And I love the way that you guys work with your community and with each other. Kathy, while we're on today, can you maybe tell us, because I do know for years you were at a hospital in Detroit, can you share with us how rural medicine is different, how this is different from that experience from an urban situation?
So that has been, my joy in moving to Northern Michigan versus the competitive environment of a suburb urban area. Mm-hmm. Really, the needs in the rural Northern Michigan are there. We have a lot of health disparities, whether it's access to screening and testing, whether it's people knowing how to enroll in insurance plans, mm-hmm. or even just not even seeking out care. So we've created this hub and spoke model where the Cancer Center now is the hub, and we have 8 locations within the 30 counties that we can provide at least infusion services and an oncologist to go to that area to meet patients in the communities that they live.
And right off the bat, I'm impressed with how your people are instantly ready to start pushing those dominoes for help.
Well, you bring up a good point. When we moved to a telehealth platform, we did 0 telehealth visits in January of 2019, and we moved to 60% telehealth visits by March.
Wow.
And we by hit or miss, we started using a platform that was a little complicated. Patients had to receive a text and then, check in, and then they received another text to see the provider. Then they received another text to check out. In our rural communities, sometimes the bandwidth is not strong. And so it would just resort to a phone call visit then, because we couldn't do the video visitor or show CAT scan results or anything. Mm-hmm. But the scripting had to continually change with the staff, letting the patient or the caregiver know what was going to happen next. As a matter of fact, it was 2 weeks ago, we just rolled out on a more advanced platform, mm-hmm. so that it almost simulates like an actual visit. So a patient logs on, they're put into a waiting room, and then the check-in people will talk to them. They're left in the waiting room. Then the provider comes in, they're left in the waiting room, and they check out. So it's a one-time connection. So that's evolved in 6 months of doing this. And so we're going to continue to do telehealth, especially our survivor visits, our chemotherapy education.
Great news.
And that's great for rural healthcare. Why do they have to drive for another visit if we can do some of this in a different way?
I love the way that you have been able to follow the needs of your patients, and that's, I'm not sure that's always the case in larger settings. And maybe it's kind of being on that pioneering frontier of rural health that allows you to follow their needs and create change or adjustments as needed. And the ability to follow those needs is very special. I think that's one thing that makes you all very unique to healthcare.
Well, we really were moving on a pathway to really do more prevention and screening. And you and I have had this conversation. I don't want to be the treatment facilities only. We have, in Northern Michigan, we have some of the highest rates of hereditary cancers. We have the highest rate of young female breast cancer. There is work that has to be done, whether we have environmental issues or whatnot up here that we have to emphasize.
Good. Will you say hello to everybody? And I appreciate you being here today. Is there anything you'd like to touch on before we close out?
I guess it's the quote that I've been using all along now during this pandemic. And it's a Winston Churchill quote that is, change is good as long as it's in the right direction. And so I have a running list of, our partnership with the community health departments have grown tremendously. So I'm really hoping we can do much more prevention, whether it's smoking cessation, all kinds of community efforts now that we've forged these relationships over the past few months. So I have a whole list of strategies that we'll continue to work on. And we'll have more to talk about when we can do the bike ride this summer. I hope not virtually.
Right. Oh, no, for sure. If anything, I'll be there.
Okay.
So, and hopefully we'll all have our vaccines by then. I'm hopeful. Knock wood sometimes, right?
Yes.
So, Kathy, again, stay safe. I hope your family as well. I miss you. I miss everybody in Traverse City, and we'll talk soon.
Keep up the good work. February 4th is a very special day.
Thanks so much. We appreciate it.
Okay.
Take care.
Bye-bye.